Here we are at part 2 of the openings of the skull, and we're beginning with, actually, I'm taking 3 in a row here, beginning with the Foramen Rotundum. I like to do these 3, Foramen Ovale, and then Foramen Spinosum. Okay, Rotundum, Ovale, Spinosum, because they they kind of appear together right here. Let's take a look. So the here's the 1, 2, 3. Rotundum, Foramen Rotundum, Foramen Ovale, Foramen Spinosum. Do you see that? It's right here in the middle fossa. Okay. And we're sort of like down to the side of the sella turcica. Okay, so we already dealt with trigeminal division 1, which is the ophthalmic that goes under here and serves the eye for touch and temperature, and the skin outside the eye. The upper lid, the forehead, and so on. Now we're going to have division 2, and it's called the maxilla, or the maxillary, the maxillary nerve, and it's going to actually penetrate through the maxillary bone, and it's going to exit way up here. Okay, so the ophthalmic was up here exiting, and it was going through an opening right there called the supraorbital notch, or foramen. And here we have the infraorbital foramen here and here, and it's going to innervate the teeth before it comes out. It's going to take care of a lot of the interior sinuses and so on, nasal sinus. And then after the teeth, it's going to exit here, take care of the lower lid of the eye, take care of the upper lip, so half of your kiss, and the skin in between here along the cheek. If you're a dentist, you might be numbing up the gum right here. And then if you're, how shall I say, adventurous, you might actually, once that gum is a little bit numbed up, you might send your hypodermic up through the tissues here and try to drop a drop of anesthesia right into that opening, so that the teeth up here, the nerves for the teeth, are definitely all numbed up just the way you like it. Okay, so this is division 2 of trigeminal. Division 1, remember, ophthalmic. Division 2, maxillary. Division 3 is going to be mandibular. Okay, and it has a larger opening down here. So we come back to this picture, and we're at Foramen Ovale Spinosum. Foramen is division 2, maxillary. Division 3, ovale. Bigger, more activity. Okay, so that's the deal here, is more activity. This is the mandibular nerve. If you were that same dentist and you were to open the mouth of your patient and look way back here at the joint, at the skin overlying the joint, or over here, you would send your hypodermic right into that skin and deliver anesthesia there. And you would get the nerve before it enters the mandibular canal. What's going to happen with that mandibular nerve, it's coming down, and it's going to enter into the bony structure here, and it's going to innervate these teeth, and then we're going to have a branch of it exit here at the mental foramen and innervate the skin and the lower lip. So that's the bottom half of your kiss. And then before it enters the canal, it's actually going to take care of the interior of the mouth for touch, which is important, includes the tongue, right? There's people who like crunchy cookies, and there's people who like soft cookies. Okay, they often marry each other and have to adjust recipes. So that sort of thing goes on. Okay, so now we have the 3 divisions of the trigeminal nerve, just the way you like it. And in the ophthalmic goes through the superior orbital fissure right here. And the maxillary goes up here with the Foramen Rotundum. Right here we have the ovale. Now finally the spinosum, which is a very interesting opening. Tiny little thing, but it's got an artery in it. And let's take a look here at our little table and pick up what we may have passed over. Cranial nerve rotundum, cranial nerve 5, division 2, trigeminal, maxillary. Okay, it goes through the infraorbital foramen. Okay, skin of the face, upper teeth. Then we have foramen ovale. Foramen ovale, cranial nerve 5, division 3, trigeminal, mandibular, lower teeth, tongue. Okay, tongue for touch. Skin, lower lip, of course. Okay, we're going to go through the mandibular canal and take care of those teeth. Now, finally, we're at the foramen spinosum. Okay, this is the middle meningeal artery. And I don't really have a lot of commentary there, but there's a lot of commentary that could be made. And the reason for that is that the artery actually takes care of the meninges. If we were to harvest a brain from one of these skulls, which we do from time to time, usually once a year we do a brain harvest when we have in-person teaching on Friday night, cadaver night, which is a course that I've been teaching for a decade. The deal is that the dura mater is very much stuck to the bony structure of the bone here, and that the artery that's serving the meninges is this middle meningeal artery. Do you see how it's embedded right in the bone? Now imagine you fell off your bicycle, you hit the curb, weren't wearing a helmet, and there is a fracture here. Okay, so head injury, especially to the side of the head along this region through here, is not uncommon at all. And if there is a fracture, there's a good chance you will interrupt the blood flow here, and it will begin to fill up the inside of the skull. The problem with this is that we're going to be having the brain pushed up this way. Do you see that? That the blood is going to be an epidural hematoma. It will fill up this region here with blood. It will press the brain against the corner here of the Turkish saddle, and all of these nerves here that are serving the eye are going to be impacted. So you can't move the eye becomes fixed. There's no dilation or constriction of the eye. It's fixed. And but the person gets up and says, oh, it doesn't hurt that much, I'm okay. And it's because there's no pain nerves here in any of this areas. And so they don't know that they're actually quite injured. A lot of people will have strokes with no pain whatsoever. They'll just cease to function in certain ways, and suddenly the ground will become, how shall I say, coming at them quickly, and they don't know why the ground did that to them. Okay, so that's the situation here with this, is that it is a potential, how shall I say, immediate cause of death or significant injury because of the push against the brain edema that results, and the stroke that could happen. So as soon as you see that event and you put two and two together that the person has an epidural hematoma, you must rush that person to the hospital. They pull out the burr, they zip, and they pull out their drill, and they open it up and release the pressure, and the blood spurts out. There's a little bit of cauterization or electrosurgery, and then there's the fixing of the skull opening, and everything's okie dokie. So these are things that are quite treatable. So meanwhile, I hope those stories are good for you. The rotundum, ovale, spinosum, 1, 2, 3. Okay? Now, this next one is a little tricky because it bears some explanation, and I may have to go into the next set here. But this is the internal carotid artery house right here. It's called the Carotid Canal. And the artery flows on a flat plane right here for a little while, and then it comes upward right there. And if you see that little opening right there, right, you can actually see something underneath the skull right there. That is not something that happens in life. That's cooked out skull. This actually has cartilage in it, hyaline cartilage. So that's actually a continuation of the floor. But, you know, anatomists are so, how shall I say, OCD or something, that they named it, even though it doesn't exist. just by cooking out the skull and cooking out the cartilage, this little jagged opening appears. And it's referred to by anatomists as the, well, here's an extra aspect of it, but they call it the Foramen Lacerum. Okay, so there is no foramen there, but I'll pick that up in the next part here.